too. Right. Well, welcome everybody to another East County Voices. Hey, there you go. I almost said it last week, but yeah, we're formerly known as the Carlos Taco Show, but we are now East County Voices. And tonight, what we got going on, Gavin?
Hello, my name is Gavin Payton. I am the East County NAACP's Council President. Also just here as a community member tonight, and we are here with Bart. Would you lovely ladies like to introduce yourself and tell us a little bit about Bart, and also tell us a little bit about yourself?
Absolutely, thank you. So my name's Danielle Aubin. I'm a patient navigator for BART programs.
Nice.
We have 3 clinics out here in Contra Costa County. The closest one to us right now is Antioch. And what we do is we help those who have developed opioid use disorder find recovery. And we do that through the assistance of medications and counseling. It's proven to be one of the most effective treatment options for opioid use disorder. And I just kind of wanted to come today and talk about how that is a viable solution, kind of talk about some of the myths that surround it, debunk some stigmas, and talk about harm reduction as a whole. And so I'm very excited that I brought my colleagues with me, April and Mariella, and I will let them introduce themselves. I'm a popcorn at April.
Unmute. Hold on, wait, I got you.
Thank you. Thanks for that. Sorry. My name is April Rivera, and I'm the founder of and executive director of the National Coalition Against Prescription Drug Abuse, and also the founder of the Contra Costa County Meds Coalition. I got started in this work, and basically our work is to engage our community members in educational programs that help them understand dangers around prescription drugs that certainly include opioids, but also stimulants and sedatives as well. And now the conversation has also evolved over to include fentanyl. We're having a big problem with illicit fentanyl, as we'll, I'm sure, discuss. The organization was founded back in 2010, just a few months after my own 21-year-old son passed away from an accidental overdose from medications he had been prescribed 9 days before. Thank you. Yeah, just absolutely devastating situation. And, as we started talking as a family with, friends, family, others that, we were surrounded by, nobody knew any more about these medications than we did, which was almost nothing. And so our mission has been really to save lives through this educational platform we've established. But that's also evolved now to include harm reduction, where we're literally going out to events, and even in our schools, we're teaching people how to recognize an overdose. And then what do you do if you see one, how to respond to one. And then those that we train in that way, we are able to give Narcan to, because we're able to get that free from our state health department. So we get it for free, we give it out for free, all of our services are free. Nice. So we feel like every day that we're out there, we have the potential of saving lives, especially when we give someone a Narcan kit.
Right. Mariella?
Yeah, hi everyone. My name is Mariella Sanding, and I'm the coordinator for the Contra Costa County Meds Coalition. So we're a community-based coalition. I've been working as a coordinator for about 2 years now, since April passed it over to me. And our mission is really to prevent prescription drug misuse and substance use disorder here in Contra Costa. And we try to reach all different audiences from schools to older adults, college students. We've educated as young as middle school aged kids, really about the dangers of misusing prescription drugs or using them recreationally. Like April said, we are right in the midst of the fentanyl crisis. We're in about our 5th year of the fentanyl crisis, where youth or young adults are seeking out prescription drugs to use recreationally, not having enough education surrounding what these medications actually do, and then running into pills or medications that are fentanyl laced because they're bought illicitly. So we try to bring that awareness to the community, provide some overdose rescue training, so how to use naloxone or Narcan to save a life. It's basically a nasal spray medication that you would give to someone in order to reverse an overdose related to opioids. So we try to get that medication into more people's hands so that we can save lives, and also just bring awareness as to what the dangers are and how to actually save someone from a potentially fatal overdose. So I'm really thankful that we have this platform tonight to be able to speak about this, and I'm excited to share more as we go on.
Right. All right. Gavin? Of course, we got to unmute that. Hold on. You got to unmute it, Gavin.
Oh, I'm sorry. I didn't.
Go. I know I'm all pressing the button. It says you chose to unmute yourself. So, yeah, you got to do it. Go ahead. Sorry.
How was your organization founded, and who founded your organization, and what is your mission?
So for BART programs, we were actually founded by a couple. It was a husband and wife who moved from New York to California to bring medication-assisted treatment in response to the heroin, I don't want to say epidemic, but the prevalence of heroin misuse amongst veterans from the Vietnam War. It was becoming an issue. They were finding that the traditional methods for treating substance use disorder wasn't really working for opioid use disorder. And through the education and research that was done on methadone as a medication for the treatment of opioid use disorder, they found it really quite effective. It was really new back then. This was in around 1977 when BART programs was established in San Francisco. And they boldly came in and brought this treatment to those who were afflicted and suffering. And as a result, it was a very effective treatment option. So much so that it was approved by the FDA and became the leading treatment option at the time for opioid use disorder. They ran that business for, I want to say it was like 22 years before eventually the business was absorbed into a bigger corporation. And then now BART programs is across the nation and also international. But it all started with like a mom and pop family owned operation. They started outside of the house that they bought in San Francisco and just started inviting people to come in to receive treatment. And they did this in conjunction with counseling. And that process of treating the whole patient really was very effective. And it sparked a bunch of MAC clinics popping up across the nation because of this work that they did.
Okay. And your mission?
Our mission is to wipe out opioid use disorder. I know that's a lofty goal. It's a lofty mission, but it's one that does need to be addressed and tackled. And it's a mission that takes more than just one group. So it's important to acknowledge that opioid use disorder, this opioid epidemic that we're facing, is multifaceted, and it is also very difficult to manage. It's one of the most opioid use disorder is one of the most difficult substance use disorders to overcome. And with assistance like MAT, medication assisted treatment, it becomes more manageable. So our mission at BART programs is to treat the whole patient. We do this through medications in conjunction with counseling. And the counseling is the most crucial part about what we do, because this is where we actually get down into what is causing the issue in the first place. With that, we also partner with other organizations to bring in resources that we just cannot do ourselves. And this is how I was able to connect with the Meds Coalition and also the National Coalition Against Prescription Drug Abuse, because by working together, you're able to address the facets of opioid use disorder before it even begins. So it's important that we start getting it before it starts. We have to get in there to prevent accidental overdose. We have to get in there and do the harm reduction piece of it. And then if opioid disorder is established both psychologically and tissue dependence, which is two different things, then that's where MAT can come in. And then we have to deal with the piece afterward. So once somebody gets into maintenance, like how are we going to maintain that recovery for that individual once they're no longer in need of the services of our programs? So it takes a lot of the community to be involved with this. It takes a lot of support. It takes a lot of people being willing to be open-minded and be accepting of some things that might be uncomfortable, but understanding that these methods they're working and they're saving lives and they're preventing substance use disorder. So that's our mission. We are an answer to the opioid epidemic as a whole, and it's a collaborative effort, and it can't be done alone.
Right.
That was beautiful.
That was.
So, how can the community support?
Well, that's kind of a tough one. So the first thing that comes to mind when someone says, okay, how can the community support? So first of all, I already have support right now in this venue. I have the Carlos Taco Show, or East Bay Voices, supporting what our message is and our mission. It's elevating information about MAT. Or medication assisted treatment. It's bringing awareness to opioid use disorder. It's bringing awareness to harm reduction strategies. And my colleagues here who have had the pleasure of partnering with are also representative here in what they do and their role in addressing the opioid epidemic. And the more people that are willing to take this information and share it and address their own personal stigmas that they may have that they might not be aware of, and also becoming aware of the stigmas that are around them and addressing them appropriately and not letting those stigmas kind of just go when they hear them, would be a great resource. I tote this all the time whenever anybody gives me some space to talk. Our language really does matter. And the words that we choose to say really do impact others. So we have to be careful, and how we describe things that we're experiencing and what our feelings are. One of the things that I find most enraging for me is when I hear folks refer to children that are being born with tissue dependency as crack babies, or those babies are addicted. Those babies are strung out. When we start saying words like that, for example, this is going to prevent that mother from getting the prenatal care that she needs to properly take care of her baby. And now she's going to go into hiding, and she's not going to come out and get help. She's not going to seek that treatment from professionals that she needs because of the way the community is making her feel. So we have to be very mindful of the words we choose, and we have to be very mindful of the words that we might not even know that we have that we're using, and be open to being corrected when we say things that are not appropriate to trying to help someone find support. So that would be the biggest thing that I think a community member could do. And then outside of that is just partnering with other organizations and just sharing this message of there is hope, there is recovery, and being open to those options.
Okay.
Nice.
All right. Thank you. So, how is this community healthcare accessible?
So BART programs is pretty accessible in the aspect that you can come in anytime, no questions asked, and ask for support. The only problem with our clinics is that we are early clinics. So we open as early as 5 a.m. and then we close at 2. So in order to get treatment, if you were a new patient, is you would need to come in somewhere between 6 a.m. and 12 p.m. So that can be kind of a barrier, but you can come in with, you don't need an appointment. You just need to have a willingness for change, that you no longer want to live the lifestyle you were living. You're ready to find treatment. You want recovery, and then we can assist.
So how long can recovery take for patients?
So that is also a very complicated answer because each person is unique. So one person might be able to find long-term recovery quicker than those who might need more time. There is part of recovery is relapse, but at the same time, with opioid use disorder, we need to acknowledge that when people are relapsing now, they're not getting that second chance to come back because of the prevalence of fentanyl now and all illicit substances out in our community. So when folks are going out and they think that, oh, I'm just misusing the original opioid that I originally had, or even if it's a different substance that they're misusing, there's a very strong potential that there is fentanyl in those illicit drugs. So it's really important that we retain people in treatment, but relapse is part of recovery. And for some folks, there might be more instances of relapse than for some that are not. So it really does depend on the amount of time it takes for someone to find recovery. But I will say that when you can note that somebody is stable in recovery, once they are living their life, meeting the goals that they have set for themselves, they're able to hold down jobs, they become functioning members of society, they're able to rebuild relationships that they may have lost with family members, develop healthy relationships, understand what boundaries are and how to maintain them, and just be able to live the life that they had prior to developing opioid use disorder. And so that's kind of how we gauge recovery. There is no length of time. So at our program and most MAT programs, there's not going to be a standard, oh, you need to sign up for 2 years. This is your 2-year contract into recovery. Or, oh, you need to be here for 30 days. It's client-centered, and the patient decides when they are ready to remove these tools from their recovery toolkit. I think this is also a good opportunity too for me to kind of like piggyback a little bit off of Mariella and April, because I think it's really important too that we talk about the fentanyl crisis that we're facing right now in our Antioch community. And I also wanted to give an opportunity to explain to the importance of the preventive side. So in harm reduction, MAT is harm reduction, but part of that too is naloxone training, making sure it's available, and then also understanding how prevalent fentanyl really is and how lethal it is and how easy it is to overdose.
Yeah, Miss April, Miss Mariella, you guys are feel free to hop in and speak as well. You guys would like to add anything?
Yeah, so really with the fentanyl crisis that we're seeing right now, it's very unique in the sense where what we're finding is individuals will go and purchase oftentimes pills, what they think are prescription grade pills from people who deal drugs illicitly. So whether that's on social media, the dark web, face to face through a friend, thinking they're getting one thing like Xanax, which is a common sedative that's used recreationally, but is prescription grade, and a stimulant like Adderall, or otherwise a quote unquote party drug like cocaine or ecstasy, right? Anything that you can really purchase illicitly from the drug market, thinking it's one thing, looking for a specific effect to use recreationally, but what they don't know is that the illicit drug market is being laced with fentanyl. Fentanyl is essentially the strongest opioid that can be prescribed in this day and age. It is prescribed for pretty severe cases of pain, like when someone, before, during, or after someone goes into surgery. It's used before mothers go into labor, right? It's used for pretty intensive pain management. But essentially, these drug dealers have figured out how to make fentanyl themselves and are lacing it in their supply. So they can either manufacture it themselves because they've figured out sort of the chemical makeup that's required for fentanyl, or they can purchase it in bulk for pretty cheap. But the issue with using fentanyl to lace their drug supply is that the amount of fentanyl that it actually takes to cause an overdose, a potentially fatal overdose, is just 2 milligrams. For reference, that looks like maybe a couple grains of salt. It's the size of a fraction of a raindrop.
Wow.
That small amount laced in any drug that's purchased illegally can cause a potentially fatal overdose. And I think, when we explain just the weight of this crisis to people, the main question that I get asked is, why is fentanyl being or why is fentanyl the drug of choice, right, for lacing? Why aren't we using things that are less potent? Why aren't we using, baby formula, whatever the case may be? The reality is that these people who are manufacturing these illicit drugs aren't worried about the fatality of fentanyl. They're worried about profit, and they're worried about customer loyalty, right? So by using essentially the strongest opioid, they are driving their customers, or the people that are going to them, to come back to them because they have, some of the strongest stuff. And like I said, it's really easy to purchase in bulk for cheaper, manufacture themselves. So that's why, when we talk about opioid use disorder and the fentanyl crisis, we're seeing a range of people who either have suffered with opioid use disorder for X amount of years, who are fatally overdosing on fentanyl, whether they know that they're taking it or not, or we're seeing people who are first-time users who are seeking out drugs that have nothing to do with opioids, and they run into an accidental fentanyl overdose.
I also wanted to add in.
Yeah, feel free to add.
I just wanted to add in too, and this is going to kind of show how deep this opioid use disorder can really go, and how deep it can take a hold of someone. I've had patients explain to me before that when there's they call it a bad dose, like a bad batch is out in the community and people are ODing, they actually go, "Hey, where'd you get it? That's the good stuff. I'm going to go get some too." Like, our friend Joe just died. Where did he get his stuff from? That's the good stuff. So even though there's a huge risk of overdose, they know it's really potent, and that's how much this opioid use disorder has a pull on people.
Yeah, I wanted to share. Yeah, we feel like education is so important. That's what, again, Moriel and I are focused on, primarily trying to get the word out about, the reality of this fentanyl scene right now, and how dangerous prescription drugs, even if they're legitimate, can be. But another part of this I wanted to make sure we share with you is that there are 2 pieces of legislation, because another thing we do is support or otherwise push back on legislation we think will either be helpful or not. And there are 2 bills that I'm really excited about. So Carlos, if it's okay, may I just share out what they are so people can do a little bit of research and maybe support them if they want to.
Share away.
Okay, so these are California state legislative pieces. So Senate Bill 997 would It would allow students in middle school and high school and adult schools to carry naloxone with them on campuses. Now, this is huge because Mariella and I are in schools all the time, and we always include overdose rescue training in our presentations. However, we're not typically allowed to leave Narcan behind with the students, naloxone. So this would make it possible to do that, which is huge. The other bill is AB 2429, and it would really require that high schools educate their students about fentanyl. And that again is huge because we're trying to share out, but we can't be in every school. So this is another really important piece of legislation. So far, I don't see that there's any opposition to either bill, but just making sure that as it gets to the Appropriations Committee, which is likely going to happen in both cases, that they see that there's enough support behind these bills to allow for the funding to go through for them would be important.
That is so amazing. You know, as the East County NAACP, the NAACP, what we do is we go out and we lobby for bills. In May, we set a special day to go to our legislators. We call it Lobby Day, and we go out and lobby the bills that we want to see in action. You guys should definitely look into that, and if you guys have bills that you want to see pushed, feel free to reach out to the NAACP because we definitely would love to lobby for these bills. Just give us the information and we'll pass it along.
Thank you. I'll follow up after this session. So that sounds great.
Yeah. And if you guys want to also come with us on Lobby Day next year, coming up in May, we do love the support from other organizations and other groups. So feel free to come and join us and let's rock the boat.
Sounds good. Thank you.
So my next question is what kind of substance abuse counseling is available?
So the type of substance use disorder counseling provide is in the form of motivational interviewing and CBT or cognitive behavioral therapy. Usually in most substance use disorder treatment settings, you're going to see motivational interviewing. And that's basically where you kind of meet the client or the individual where they're at. So not everybody is as ready as the other person when it's coming to, when in the recovery process. And when you work in a harm reduction, you can get folks that are just not ready at all. They're not even thinking about it. They're there for some other reason. It could be court ordered, a loved one forced them to go. In our case, sometimes we get folks who don't want to go and withdraw and they can't get access to their original drug of choice. And so they'll come to us so that they can abate the withdrawal symptoms while they wait for their drug of choice to become available. So that's where motivational interviewing comes in. It's how do we roll with that resistance? How do we address that ambivalence? And how do we get that person to become interested in exploring recovery? And it's patient-led, where the interviewer will just kind of pose questions to get them to start thinking about their current life, the behaviors and the consequences of their current lifestyle, and kind of in a way kind of hold up a mirror so they can see themselves, to see actually where they currently are and where they may want to go. So lots of rolling resistance, lots of trying to meet them where they're at as you guide them through the recovery process. And then with cognitive behavioral therapy, that's more when folks are ready to start doing the work. So once they get to the point where they've acknowledged that there's an issue and they want to try to resolve it and work towards a healthier lifestyle, then you can start implementing strategies and plans and goals to help them get to that point. And that's where the beautiful things start to kind of happen when you see people making goals and getting to those goals, obtaining those goals, and then getting into like the recovery process that we're all hoping for, to where they eventually can go out and help others also find recovery. So that's the more planning, working part, whereas the motivational interviewing is just kind of trying to guide people in. Another great thing about motivational interviewing too is when you're dealing with folks that are in early recovery, there's usually going to be a lot of crises that pop up. And you, with motivational interviewing, it's very open, flexible structure. So when someone comes in, if there's something that's happening right now that they need to work out with their counselor, it allows for that. Whereas CBT is more structured.
Okay, thank you. As I ask from the community that is watching, please feel free to put your questions in the chat. We're 30 minutes in. Let's get some community feedback. But as they type their
Right.
questions and get their questions flowing, um, what insurance do people need, and what if they're not enrolled?
So that's a good question. One of the major barriers to folks not getting connected to treatment outside of stigmas is funding sources. At BART programs, we do accept Medicaid or Medi-Cal. We accept Medicare, VA insurance, and some commercial plans. The ones I can think of right now that we accept is Anthem Blue Cross and Aetna. We also work with Kaiser as well. So there's some other ones we can take too, like PPO commercial plans that we can take. We can work with our patients to try and make sure they have a funding source. But a lot of times we find that it's difficult to get funding for medication assisted treatment when you don't have Medicaid. So we're fortunate enough to be recipients of the state opioid response grant at our Antioch and Richmond clinics, which allow us to provide treatment for free while we help that individual find a better funding source to continue their treatment. So we do have, that's great. Free treatment is always great. Just unfortunately, not all of our clinics have it. So our Concord clinic does not have the state opioid response grant, but our Antioch and Richmond clinics do. And we can use that to help folks get find treatment.
Thank you. So I don't think there's any questions from the community just yet. What is your day-to-day work with patients?
So a day in the life of one of our patients is they're going to be coming to our clinic pretty frequently for a while. They're going to be coming in daily. This is especially in early recovery, and this is because we need to ensure that the patient is stabilized before we can set them out on their own with these medications. There are some risks with medication-assisted treatment, or I should say with the medications that we use in treatment, if someone is not taking them appropriately. We also need to set up accountability for our patients. So initially there will be daily visits to the clinic to receive medication. And when folks are new in recovery, we're also going to mandate more counseling. We do this, the state does require a minimum of 50 minutes a month, but when someone is brand new, we require a meeting at least once a week with a counselor. And that can be frustrating for some folks, especially folks that are not ready for treatment. They're in pre-contemplation. So they're not really there for the counseling. They're there for the medications. And so in that case, when patients fail to follow through with their counseling, that is one of the few times we will discharge someone from our program. And what that essentially means, and the reason why I put up the little fingers there, is because we don't actually kick anyone out, but we will require them to go through intake again. And intake is irritating and it's long. And, you know, if you just sat and talked to your counselor for 30 minutes, that'd be a lot quicker to get your medication than if you were forced to sit 2 to 3 hours for intake. So that's kind of how we get them to adhere to counseling if they want the medications. And again, counseling is really, really crucial for the recovery of someone who is suffering with opioid use disorder, because without it, people can be successful, but you really have to work through those issues that got you there in the first place. No one wakes up one day and decides that this is their life goal, that they want to be, have tissue dependency to something like this. No one does. And so there is something that caused a sum of choices and decisions and behaviors that led to it. And we need to figure out what that was so that it doesn't happen again and how to best cope with those situations. So for a while, there will be a lot of time spent in the clinic. But as time goes on and people become more stable in their recovery, they get take homes, so they don't have to come in every day to take their medication. And then, as I mentioned earlier, it can get down to the point where they only need to sit down with a counselor once a month for 50 minutes.
Oh, that's not bad.
Mm-hmm. Once we get into that long-term recovery. So that's like 6 months, like at the earliest.
April, Mariella, would you like to add on to that?
I myself don't see patients in that aspect. We more so just talk to general community members who don't necessarily have opioid use disorder, although they can. But we don't work on the treatment side. For the Meds Coalition, what we really focus on is prevention of substance use disorder and getting education to the community before they use drugs at all.
What I would be interested in sharing about is some of the work that's being done with the Meds Coalition. So one of the things I love about working with the Contra Costa County Meds Coalition is that they go out into the community and they go in places where you wouldn't suspect that there would be a need or a desire for things to learn about, like fentanyl, prescription misuse, and the availability of Narcan and how to get it and how to get trained to properly use it. So I think that's really great work that they're doing. And I think it's one of the most important things is that people get trained on how to use naloxone, like know what naloxone is, know how to use it, know how to recognize when someone might be experiencing an overdose, and how to prevent misuse. And going into schools is one of the things they do too. But I also think it's great that they will meet anybody where they are at. They go out into health fairs where you would think that that's not where you would suspect like someone with a need of opioid use disorder would go. And that's because they're reaching families that may come across someone who might have that accidental, come across either intentionally or unintentionally. There are situations where people don't even know that they've come in contact with fentanyl. And if you have somebody there with Narcan, they're able to reverse that and save someone's life. So I think that's something that would be great to talk about. And I know April's doing some virtual trainings as well for folks to learn how to use Narcan.
Yeah, I think what I'd want to make sure everyone knows is that it isn't just talking to middle school and high schoolers and their parents. To your point, Danielle, we're out there, meeting with people that are in high risk, either geographic locations or they are part of a community that we know is considered to be high risk for drug use. And if they're using drugs, they can be at high risk, of course, for overdose. So a great example would have been last weekend. NCAPDA was out in Fremont at the library where they had a Pride event. So it was a fair that was really surrounding that community. And we were out there for only 4 hours. And in 4 hours, we gave out 90 kits, 90 Narcan kits, which is probably an all-time record, really. I personally couldn't be there, but the feedback I've received from the volunteers who were indicated that they had a lot of really meaningful conversations. It was really clear we were meeting people who needed and understood the value of Narcan, and they definitely were appreciative of getting it. Another project that we've got going on in both Alameda and Contra Costa County that both Mariella and I are involved with is going to be the placement of newsstand boxes. So feature the old newspaper boxes that you put your quarter or whatever in and you get a newspaper. Well, now you're going to be able to get Narcan for free without putting your quarter in. And so we're going to be distributing those in strategic locations throughout both counties. So it will make Narcan available to those who really need it 24/7.
Nice. Did you guys see the question?
Yeah, I wanted to get to that.
Yeah, interesting question.
Right.
So I have my own 2 cents on this. And this is Danielle, not Bar Programs, but so this isn't a part of affiliate with them or anything like that. But we have the war on drugs. It's still there. It's still in operation, and it's clearly not working. People they tried it, but people are being either arrested and incarcerated for nonviolent situations. They're becoming better at manufacturing or learning how to misuse it and sell it to others when they get out. It's not working, and it also sorry, sweetheart. It also makes it more lucrative for the illicit use for drug dealers to make money. If it was legal, there wouldn't be as much of a financial gain because anybody could access it, and there wouldn't be there wouldn't be like, oh, where can I get it? What can I pay for to get this?
Right.
So I don't think it's working. I think treatment needs to be the focus rather than the how can we criminalize this? Yeah. Anyways, I'm sorry, I'm getting distracted. This is my daughter Lexi. She is now part of the East Bay Voices show.
That's
and
good.
This is
Welcome.
why we do what we do.
Right. So I had a question. I know I asked it in the private chat, and I want to give an example of that. I had asked, what are some of the myths about fentanyl? And like one myth is like some people, there's been a video going around where a cop like saw someone, on the ground, and like he like touched him, and when he touched him, then he got the fentanyl overdose and all that. I mean, I've talked to some paramedics, and they were like, that's not true. I touch it all the time, and that's never happened. I mean, but what's the truth about that? So like, also, if someone's trained to see, oh, this person is overdosing off fentanyl, more than likely, is it okay to touch them and give them the treatment? And that's the treatment's up the nose, right? Yeah.
Yes. Nasal spray.
Yeah, it's a 1-dose nasal spray. Yeah.
Yeah.
Can you just talk a little bit more on the myths and stigmas, especially around the African American and Latino communities, also a little bit on the LGBTQ community as well, because there's such high stigmas and propaganda against that. So can you please clear some of those things up?
Yeah, I want to first go back to Carlos's question about the myth about touching fentanyl. So I haven't seen that exact video, but I did hear of another sort of, a police officer coming across fentanyl and overdosing by touching it.
Yeah.
The truth is that no one can overdose from fentanyl simply by touching the pill or the drug itself, or touching a person who has taken the drug. You can't overdose on fentanyl through the skin or transdermally, so the skin can't absorb fentanyl and then overdose. It would have to be ingested, so whether that's swallowing a pill, eating something, or inhaling it, so through smoking, snorting a powder, so on and so forth. But direct skin-to-skin contact would not cause an overdose in that sense.
All right. Well, thank you.
But it is easy though to overdose by inhaling it. Like sometimes there have been situations where I've had patients explain that like their partner was still using and had dropped some into the carpet, and then their dog had sniffed in the carpet, and the dog had overdosed. So, and you hear stories all the time in the media about little toddlers like playing on the ground, and then they will eventually somehow inhale it or like get it on their fingers and put it in their mouth or up their nose or whatnot, being a kid, and you can overdose. So I think that's kind of where the myth came from about the skin to skin contact. It just takes a tiny little bit to cause a fatal overdose.
Wow.
And it can happen within minutes too. That's why it's so important to have this Narcan on hand.
Wow.
And you can use it on animals. My patient saved her dog with expired Narcan. So even if it's expired, try it. It's
wow.
Yeah.
And children.
Mm-hmm.
So the Narcan, the one dose is good for, it can help a child too then, huh?
Yes. You have to use for kids too.
Yeah, no age restriction. To the other point about how it's affecting the African American community and the Latino community, they're part of what the Meds Coalition and NCUPDA both do is look at a lot of data in our community as far as overdose goes and where overdoses are happening. We're constantly tracking how it's affecting our community. And what I've seen from looking at overdose data here in Contra Costa, geographically, the cities with the highest rates of opioid overdose are Antioch, Richmond, and Pittsburgh. And for those of us that live in the community or work in the community, we know that African Americans and Latinos are highly represented in those areas as well. And so there's that sort of correlation as far as the impact goes. There is definitely stigma in those communities, especially when we are considering if they have a religious background, if they're affiliated with a faith-based organization. There tends to be a lot of stigma surrounding substance use disorder, or what some people call addiction, that it's the individual's fault, that they're partaking in something that's not, sort of in line with their beliefs or their values, and that a lot of the blame is placed on the individual rather than seeing it as a health disorder, right? It's something that people need actual medical care for and something that needs to be treated with the same sensitivity and care as any other sickness. But unfortunately, that stigma exists in those communities. So what we try to do is help people become aware of how serious the situation is and that it is, like I said, a disorder and it needs to be treated as such. And that, also when people develop opioid use disorders, oftentimes it can stem from what started out as a legitimate prescription from their doctor. I don't know if anyone wants to add to that point, but that's sort of what I've been seeing with the research that I've been doing here in Contra Costa.
Yeah, additionally, I just want to add that while those two populations, per the data, are definitely those focus areas that we've got because of the data, and we want to be as impactful as we can be, I see another problem, and that is with other immigrant families of all sorts of different ethnicities that are coming over here to live. Their kids are going into our schools, and there is such a disconnect between the parents and the children. The teens, there is not keen communication. There's a lot of denial. There's definitely huge stigma. And how do you address that? And how can we communicate with those individuals, whether they're parents or the youth, in a way that will resonate with them, given their backgrounds that we don't really necessarily understand too well. So there's a huge problem, I think, around the country, but we certainly have that here because we have just such a homogenous, cultural environment here, all sorts of ethnicities, and it continues to grow. So how do we address that is really a big question and an important one, I think.
Thank you. That is so important. So, what is Narcan?
Well, I think we've been talking about it quite a bit, but Narcan or naloxone is basically the antidote to an opioid overdose. It is the medication that you would provide to somebody or administer to somebody who has taken too much opioids or opiates in their system and have succumbed to an overdose. And I'm going to leave the rest there for April and Mariella because they're more of an expert on that part. But at simplicity, it's the antidote. It's the medication that you would give someone who has sustained an overdose.
I
from
happen to
opioids.
let's see if this shows up okay. I do happen to have a little cartridge. It's a used one.
I was going to get mine.
Okay, maybe yours will.
No, you beat me.
Anyway, yeah, so it's just a nasal spray. It's super easy to use. You just put it up into a nostril, and there's a little plunger here. You push upward, and the medication comes out the tip of the nozzle into their nose, up into their brain receptors, and it will hopefully, within a couple of minutes, push aside the opioid from the brain receptors that are keeping the person from breathing. And then breathing resumes, and hopefully they continue to breathe okay. So, yeah, our overdose kits have 2 of these cartridges, which hopefully will be enough, but I've heard some horror stories. Most recently, it took 13 of these cartridges to reverse an overdose. I know, it keeps getting more and more, it seems, but usually 2 up to 4 or 5. So having a couple of kits and making sure you don't throw it away. It has an expiration date on it, but I think it was you, Danielle, that mentioned that, somebody sprayed, Narcan and and it was even, expired and it still worked. It may keep working, as long as it's temperature controlled generally for even a year or 2 after the expiration date. So don't throw it away. Keep it as an extra spare in case you need more than 2. Go ahead and get a fresh one. So, but it can be highly effective.
Yeah. I also want to add to that, it's so important, even if, and this is still an issue that naloxone isn't super accessible, which is why both April and I's organizations try to get Narcan in the hands of more people, or naloxone. But really, the best thing to equip ourselves with is to know what the signs are when we're looking at someone who's overdosing. So what is that person actually experiencing? What does that sort of look like? How can we identify it if we're just, walking down the street? Really, the most important thing is loss of consciousness, right? So they're passed out, and slow, shallow, minimal breathing. So, a way that you can check that is sort of the rise and fall of someone's chest. Someone's just sleeping or taking a nap, you can tell that they're breathing by the rise and fall of their chest pretty obviously. Whereas if they're overdosing, that rise and fall will be really minimal. If at all detected, it might be hard to even see if they're breathing at all. Sometimes when I offer the overdose rescue training, people are hesitant to give naloxone or Narcan because, what if they're not actually overdosing? What if they're passed out or unconscious for another reason other than something due to opioids? But what's really great about the medication naloxone is that if you were to give someone naloxone and they're not actually overdosing on opioids, it will have 0 adverse effects on that person, both physically and mentally, right? So naloxone's formulated so that even if you give it to someone that didn't need it, they would be completely fine. I know that there are other people who provide overdose rescue trainings who will spray Narcan or naloxone into their nose while they're giving the training, just to show that it doesn't hurt in any way. So that's a really great thing to know, is if you have, any sort of indication that they could be overdosing, I always say it's better safe than sorry to just give it to someone. Worst case scenario is that they didn't need it, and you use your dose. Best case scenario is that you've rescued them from an overdose.
Mm-hmm. Another thing we haven't mentioned, but probably needs to be mentioned, is fentanyl test strips. So there are test strips that can be used to determine whether fentanyl is present or not in a drug that somebody is thinking they might want to try, or they purchase something they are planning to try.
Mm.
There are some cautions along the lines of using a fentanyl test strip, though, because if you don't test, let's take a pill, for instance. You want to test and see if a pill is legitimate or not. You're going to have to crush the pill, put it in, powder form. If you do not test the entire batch of powder that was derived from the pill, then you might be testing a part of the pill that doesn't have fentanyl in it. Our drug cartels, primarily making these pills, they have no quality control, of course. So, they're just batching this stuff up, and there could be bits and pieces of fentanyl in that pill. It could be 100%. There could be nothing in it other than binding material. So you just don't know. So the key is, if you're going to test the whole pill, you have to make it water soluble to use the test strip. So then you're either going to have to drink the liquid and hope you get some value out of it if you think that it's safe to consume at all. Or if you just take a little piece, you may be at risk still for an overdose if the rest of the pill has fentanyl, or the rest of a bag of cocaine, or whatever that might look like. So
we got some questions here. There you go.
yeah, multiple ways for sure. Our youth are going to social media platforms. Our newsletter this month, we're going to be putting out probably by tomorrow, is going to have information about the fentanyls, we call them, and where they're derived from. Our youth are getting them through social media platforms. Snapchat in particular is the number one probably social media platform where they can get it. And you can imagine why, because the information disappears, right? The conversation between a drug dealer and the person looking for the drugs. So it's easy to hide that transaction. The pills, then, once you make that connection to a drug dealer, whether it's over social media platforms or otherwise, they'll deliver the stuff to your house. They'll meet somebody in a park. They'll meet you wherever they need to transfer it over and get their money. So
Wow.
those are just some ways. And we've just got drug dealers, period. Drug dealers may be a high school student at a high school these days. More and more young people are being, solicited to sell these pills in particular because young people trust young people. That happened over at Concord High a couple of years ago, where a girl just sold a pill to one of the kids on campus, and that girl died after taking that pill before going to bed that night. So that's not the only incident I've heard of. So as an example.
Yeah. It is so sad that our youth is vulnerable to this. And even though social media is a tool to help us, it'll also be our worst enemy. But we can't let it be that.
Mhm.
There's ways that we can do better with social media. Instead of just banning social media apps altogether, we should just come up with rules and guidelines and also hear from youth of what they want to see to have social media go better. And another way to also do that is for us to go to the polls and vote.
Mhm.
Our elections are coming up in November. I would like to also introduce you to one of our community advocates, a really good friend, and an amazing mom, Miss Patty. Oh,
And
she's
we lost our signal.
Oh,
Perfect timing, huh?
Mhm.
yeah.
um okay, so while she
Well, she's buffering.
buffering, what um what is medication based treatment? What is medication assisted treatment?
Yeah. So I'm not too sure what medication-based treatment is, but I think it's another term for medication-assisted treatment. And essentially, what that is you take medications in conjunction with counseling to treat a substance use disorder. And in the case of opioid use disorder, or opiates with these medications. And what these medications do is they remove the withdrawal symptoms that can be absolutely crippling and brutal when you're withdrawing from opioids. When someone has established tissue dependency, it's been described as me as the flu on steroids. I've seen patients report hallucinations, gastrointestinal distress, severe anxiety, insomnia, inability to keep nutrition or hydration down, which all compounds into people giving up and going back out and using just to get rid of the withdrawal symptoms. And then if someone is able to power through the withdrawal symptoms, the cravings is usually what gets people. The obsessive thoughts trying to get those illicit opioids, as the brain has been hijacked by these now to think that it needs them for survival, like food and water, is overwhelming. The constant obsessing over it. These medications remove those obsessive thoughts, remove those cravings, and remove the withdrawal symptoms. And a lot of times I hear in the community, this is like the myth I hear all the time is, well, if you're removing illicit opioids and replacing them with these medications, aren't you just switching one drug for another? And I can see how someone could have that concern, and it's a valid concern. But the key difference between these medications versus the illicit opioids, we'll use heroin, for example, is that when someone misuses heroin, you get an immediate euphoric high, a quick onset that's very short-lived. And then there is the come down, and then there's the craving, and then there's a repeat. And this happens several times a day, which leads to unwanted behaviors that are very disruptive to one's life. When you take these medications, they're very long acting. So when someone takes one dose of methadone or buprenorphine, for example, this medication stays in the system for an entire 24 hours. It has a very short onset and has a very long half-life. So there is no quick rush or peak to get that big euphoric high that you would be getting from misusing heroin or fentanyl or any other type of pain medication or illicit opioid. And instead, it's very slow. So there's no euphoric high. You're not going to get that from these medications. Even if you take a bunch, you're not going to get that from these medications. It's just not physically possible. What can happen, though, is there can be, if it is misused and lots of it is taken outside of the dose that's been prescribed by a medical provider, then you can get some of the sedative effects. It is still an opiate as well. And those are some of the side effects of opioids. And there can be risk for being too sedated. And then that's, again, why we train our patients and our families on Narcan to have it available. Know how to use it, what overdose looks like, but also just, to be aware. So if someone says like, well, I have this, I know my neighbor, whenever they take their medication, they're just like nodding out or they're completely loaded. That's not what's happening. What it is that either if they are misusing it in that case, because there's other instances why that can happen, but if they are misusing it, they're just getting the sedative effects. There's no euphoric high that you would get from misusing heroin or fentanyl or any other kind of illicit opioid.
Thank you so much. I want to put the second last comment up.
Which one's that?
The one that Patty sent.
Oh, the last this one. Thank you all so much.
Yeah.
I'd also like to point out, April put in the chat a website that you can go to where you can get virtually trained in Narcan, how to use it. And then once you've completed the training, you can go pick up your very own kit to have on your persons.
Yeah. Yeah.
Putting it in right now. Hold on.
Thank you, Carlos. Yeah, those are every 2 weeks and usually on Tuesdays. So far, we've just honed in on Tuesdays. Once a month, they're in the morning. Another time in the month, they're in the afternoon. And they're free. And again, overdose rescue kits for free after the training's completed. You get a training certificate also if you need that for work or whatever. And one of the locations to pick up Narcan from, for those who are in the East Bay, is the BART location in Antioch. So
for those of y'all who can't see, I know because the lettering's small, so there you go.
That's good.
ncapda.org.
Mhm.
And also, how can the people in the community get in contact with you, get in touch with you? How can they get in, like, is there a contact for you particularly? You guys have cards, online cards, other than your
For
web?
our programs, I would recommend going to our website and looking for your specific clinic that's best suited for you. We have our hours of operation on each for each clinic. I recommend if you are seeking treatment for yourself to just come in as soon as we open. I would recommend coming in around 6:30 and then be prepared to hang out for a little while, about 2 hours or so, and then at the end you'll be given a counselor and you'll meet with our doctor and you'll receive your medication that day. And it's the same as well for our Concord location and Richmond location. However, if anybody is interested in having an appointment, that is also an option. Usually people don't keep their appointments because this can be scary. You're changing your life, and so that's okay. If someone makes an appointment and they don't show or they cancel, that's okay. You can still come in later and walk in. But if you do want to have an appointment, please call and we can schedule that for you as well.
Right. And I got a number here too. Is the 925-480-7723? Is that the number they call?
Well,
That is for the
yeah.
that's for National Coalition Against Prescription Drug Abuse. Let me look up the phone number for our Antioch location.
Okay.
And I also put both my email and our coalition's website. Again, our coalition provides overdose rescue training and access to naloxone for free to anyone that requests it. So if anyone is interested in maybe getting their staff members trained on Narcan or naloxone, or they need a supply for their business or organization, or they want to educate some kids, whether we go to Cub Scouts, Girl Scouts, schools, all of that. So again, all of those resources are free, and you can contact me via that email that I dropped or the website itself.
Right. I'm not a fast typer. So it's MSAND as in David, ING at BACR.org or CCCMedsCoalition.org.
That's correct. Thank you.
Yeah. Thank you. Thank you guys so much for, taking the time and coming on the show. And I learned a lot. I didn't, and I'm glad that you guys, the organization that is around, I dealt with homeless for the quite a few years, and one of the things that it's common talk was did you hear so and so passed away from fentanyl? So when I heard Danielle talking about it, somebody died, they want to know who it was because that it's a powerful drug. That's what we hear all the time out there. It's sad, but that's a reality. But what I wanted to ask also was on your recovery programs, do you guys have your own? Well, you have your own, but if they want to continue, do you tell them to go to like a NA meeting or something, or are you guys?
Yeah, so we can't do everything. Unfortunately, I wish we could, but we can't. And so I personally, and I know a lot of other counselors like to push 12-step programs. NA is an excellent resource for those who need additional support with any kind of substance use disorder. And then there's of course AA for alcohol use disorder. But yeah, we definitely push that as an additional resource, and I believe we still have their literature in our lobby.
Nice.
We also provide additional resources for a higher level of care. So we're primarily outpatient, but sometimes folks need more intensive outpatient or they need residential treatment. And we work with a lot of treatment centers here in Contra Costa County, and I can refer them to that. And I also, while I'm here on this platform, I just want to say, we do help with opioid use disorder, but I am very deeply connected in the treatment community out here, and I am a former substance use disorder counselor myself. So if someone needs assistance with something that's not opioid use disorder related, I can still help, at least with a referral. Even if Bart can't help, we can find somebody who can.
Nice. That was the next question. Was this?
Yep, you answered.
So that's awesome. That's wow.
Yeah. Thank you so much, ladies, for being on. Is there any closing remarks that you'd like to give before we hop off?
Just thank you for giving us this platform to share the importance of getting help and how to prevent overdose.
Thank you.
I just want to also, but one other thing, last item for me would be, as a bereaved mom myself, I think it's important to offer opportunities for people to know about bereavement services. So for those families who've lost a child to an overdose, Compassionate Friends, there's actually a chapter in Concord and other places in the county. So it would be good to share that out with those who need the support.
Right. All right. Well, with that, we want to thank everybody for tuning in. Thank you guys for coming on. And again, this is East County Voices. We're on every Thursday, 8 p.m. Pacific Standard Time. And Gavin, thank you so much for helping me out.
No
Appreciate
problem. Do you want to put up that flyer that you got up earlier?
Oh, yeah. Thank you. See, that's you guys. So this Saturday we got a it's called Unleashed. Let me show the other flyer here. It's going to be in the city of Antioch at City Park on 10th and A Street. We got, so it says here there's going to be custom cars. We got free haircuts, right? Food giveaway and a hip hop concert with Christian rapper EGR. So come on out. If you know anybody who needs help with some groceries, or you trying to get cut for the weekend or whatever, get that haircut going, come through. It's at I believe 1:00. So yeah, come on down. It's a community and family event, and it's sponsored by Victory Outreach Antioch. So come on down, you guys. We'd love to have you there. And with that, again, thank you all for being on the show. I appreciate it. Wouldn't be a show without people like you guys doing what you do, and I just want to tell you thank you from the bottom of my heart.
Thank you.
Thank you so much.
All right.
Thank
And then we'll see you guys, Lord willing, next week. God bless you guys. Good night.
Good night.
Good night.